let's pivot for a second and let's talk about layoffs. All right. One of the big stories right now is layoffs. Obviously, we all know that layoffs is happening everywhere, but it's really, really being impacted when it comes to the federal government. I've even seen a lot of people talk about the contracts that they are losing as a result of layoffs. Make sure you guys hit a like for the algorithm, subscribe to the channel, and turn on your notifications. I want to share a couple different clips with you guys and then break down what's happening.
And we begin with the Bay Area federal employees suddenly finding out they no longer have a job protecting the health of Americans. Good evening. I'm Ryan Yamamoto. It was an emotional day in San Francisco as people received early morning emails saying they were fired. Others simply unable to access the building when they showed up for work. Our Kara St. Cyr spoke to workers and how they're now trying to figure out how they're going to put food on the table. Kara.
Gonna have to get a regular private
Ryan,
job.
Workers told me that the atmosphere in this building had been anxiety-ridden for days. While they definitely knew that there was a chance there could be cuts, they didn't expect it to come so soon. So they were shocked when they opened their emails this morning to a letter notifying them that they had been let go.
And I bet you they all voted for Kamala Harris too. Where's that at? Over in San Francisco? And don't worry, I am sympathetic to the people that are getting laid off, but let's be clear. And I've heard from a lot of people that work for the federal government that they are absolutely abysmal when it comes to taking care of business and being for the people.
Sorry. Tears flowed at the Nancy Pelosi Federal Building here in San Francisco.
The Nancy Pelosi Federal Building, y'all. Oh my God. Let me be a little bit more empathetic. I see they crying and they hugging over in the window next to the plants.
Several hundred federal workers learned they've been
Nancy
fired.
Pelosi Federal Building.
We're kind of shocked. We just got the notice. We're passionate. We're committed public servants. So it's hard.
Arendira Guerrero was just one of more than 10,000 federal employees fired in a mass layoff across the U.S. Health and Human Services Department today, with the closure of this building set to impact more than 300 staffers. Health Secretary Robert Kennedy Jr. ordered the cuts in his effort to remake the agency.
We're going to streamline HHS to make our agency more efficient and more effective. We're going to imbue the agency with a clear sense of mission to radically improve the health of Americans and to improve agency morale.
The Pelosi building where Guerrero worked each day operates federal health programs like Medicaid and resources for AIDS and HIV care. Former Speaker Nancy Pelosi fired back at the cuts, saying the reported plans to restructure HHS and close the San Francisco regional office would directly harm our most vulnerable communities and make America sicker. Tyler Tamir, the executive director of the San Francisco AIDS Foundation, says the cuts send a clear message.
It still causes extreme fear. In folks that are living with HIV, it causes a feeling of instability and uncertainty.
Julie Fong, who was also fired, says the impact will be felt even wider.
I don't think the regular taxpayer understands how government works and how these services actually serve them until they don't get their Social Security payment, they don't get their SNAP, they don't get their welfare check.
Well, we gonna find out today, ain't we? We definitely gonna find out. This is what else is happening across the United States of America when it comes to layoffs. And I believe this is over in Washington.
Today, the Trump administration began laying off employees from the Department of Health and Human Services. You can see employees at the HHS office in Rockville had to wait outside in line for hours, and in some cases only to find out they'd lost their jobs. Now, the news comes days after HHS Secretary Robert F. Kennedy Jr. announced his department plans to slash about 10,000 of those jobs. News 4's Amy Cho spoke with some medical experts about what this could mean.
How many people work for the Health and Human Services Division in the United States of America? Just curious.
Mean for your health.
This was the scene as federal health employees showed up to work in Rockville this morning. A line around the block as people waited to scan their badge and see if they still had a job. Meanwhile, on the Hill, some terminated Health and Human Services workers protested in the halls of the Capitol. One fired HHS employee says he tried to talk to Republican Senator Jim Banks of Indiana.
He looked at me and said, "You probably deserved it." Just alarming and off-putting to hear, especially when I mentioned that I did programs for people with disabilities. I'm sure he has a lot of constituents with disabilities in his state.
News 4 asked Senator Banks' office for comment about the interaction. They sent us a 2-word statement saying truth hurts. The exact number of Health and Human Services employees fired today isn't yet clear, but Secretary Robert F. Kennedy Jr. says he plans to cut about 10,000 people to save taxpayer money and
Hey, remember when in the beginning of the year when it was talking about, hey, you might want to take the buyout? Remember when we was doing that across all government agencies and y'all told me that I was crazy and no, I'm not doing that and this and that and so on and so forth? Remember that? I said, man, listen, it's a possibility that it's going to touch you. You need to be careful. You need to make sure that you, if you can, make sure that you take whatever package, whatever benefit package. I think that they was offering 8 months at the time. Plus you need to go and get a new job. I bet you it's some people, it's a lot of people that is probably thinking twice like, man, I don't want to be on the unemployment line. I just want to continue to get this bag. It was a lot of people that sat there and went back and forth and was sassy with me.
Tackle what he calls bureaucratic waste.
That video.
According to public health experts, the HHS employees fired today worked on issues like infectious disease, gun violence prevention, birth defects, mine safety.
Gun violence prevention.
HIV prevention, air quality, and tobacco awareness.
We are crippling the very system that's in place to protect us.
Today, health experts from around the country sounding the alarm. They're worried the cuts could set back medical research by decades.
To lose some of that capacity and progress is really catastrophic for us on the ground level.
In the midst of public health crises like the measles outbreak right now, why attack the very institutions solely focused on our health and well-being?
The Trump administration has promised the job cuts will not impact the FDA's food and drug inspections or Medicare and Medicaid. The administration also says the job cuts will save about $1.8 billion. If you do the math, that is less than 1/10 of 1% of the department's total budget.
Oh, well, then they should be all right. Let me get this from another lens really quickly. This is HHS job cuts and San Francisco, another view from the Nancy Pelosi building.
Sobering day for thousands of employees at the U.S. Department of Health and Human Services, now run by Robert F. Kennedy Jr. They woke up to the news that their jobs have been eliminated, including 300 people working out of the federal building in San Francisco. The latest wave of layoffs linked to DOGE, President Trump's Department of Government Efficiency. Here's NBC Bay Area's Sergio Quintana.
Some are calling this a sign of the times. Health and Human Services employees walking out of their offices with shopping bags or boxes full of their personal items after learning their job has been eliminated. Many of those we spoke to today say this announcement is a shock.
This actually was my dream job. So if you see, I brought a plan. I settled in. I was planning to stay here and retire in this job.
We found by email very early in the morning.
But employees couldn't show us.
She was planning on staying there and retiring from that particular job. That is a lot of confidence, because a lot of people just was going over to the federal government and they would just work there for the rest of their life, get student loan forgiveness after 10 years and rock out.
That email because they've already been locked out of their federal email
just
accounts.
Like the regular people.
Just a no hard. There's just no sense to it. My computer was turned off. I didn't get to sign what I was supposed to sign. It's just total chaos.
The employees we talked with tell us that they worked for federal programs serving some of the poorest Americans in several states, territories, and Native American tribes across the Southwest and Pacific. According to Speaker Emerita Nancy Pelosi's office, there are more than 300 HHS employees housed at the agency's San Francisco office. All of their jobs have been eliminated. They serviced an array of programs, including food assistance and welfare programs like SNAP and TANF, Head Start.
Yeah, I think that it's time to start eliminating all of the handouts that we see being given to the United States, being given within the United States of America. A lot of that stuff actually went over to illegal migrants. So